Welcome to this new episode. Today we're going to look at the treatment of the specific cervico-dorsal area. Functionally, the specific cervico-dorsal area encompasses the tract between C5, C6 to T1, T2. And dysfunction in this stretch might be mechanically related to the cervical, to the shoulder, or lower thoracic tract. That's why we're going to look at several integrated cervical dorsal treatment techniques, along with the cervical, shoulder, and thoracic tract. Typically, mobility dysfunctions of this tract can occur due to occupational factors, flawed posture, trauma, and repeated microtraumas. Treatment will be based on the soft tissue mobilization, joint mobilization, and manipulation. We will start with the patient in a sitting position so that we can begin to approach the cervical-dorsal tract more specifically from an articular point of view. In this way, we can begin with mobilizing the patient in lateral inclination of the cervical spine through the cervical leverage. We can begin to add the extension movement to lateral inclination, creating more fulcrum through the leverage of our body. We can combine this kind of treatment to soft tissue treatment. The result will be a mobilization of the cervical dorsal tract and a release of soft tissue related to the cervical dorsal mechanics. In this way, I will be able to start working the posterior superior dentate muscle, obtaining a mobilization of the scapula and the cervical thoracic tract. By bringing the patient more towards me, I will be able to work the longissimus dorsi to arrive up to the longus muscle of the head and the neck. It is essential to have a fluid head movement that allows us to bring the leverage to the tract I want to mobilize.